Hi, I'm going to talk to you a little bit about a problem that I see actually quite frequently, and that problem is an enlarged gastric sleeve. Now, what I'm talking about is that after surgery, the stomach that's remaining after you have a gastric sleeve procedure actually expands. So, how does that happen? Do you stretch it out? Well, unlikely that you stretch it a lot. Usually, when the stomach expands, there's either something anatomically wrong that causes more stretching than is normal, or the stomach was just too big in the first place and easily expanded. But no matter how this procedure was done at the beginning, the stomach is going to expand a little over time, and I call that accommodation because the stomach wants to go back to digesting and adapting to as much food as you want to eat. And so it'll tend to expand. Now, if it doesn't, what happens is you tend to have a much lower appetite, and you also get full with smaller amounts of food. If the stomach expands, your appetite will oftentimes go up, but you'll certainly be able to eat more food at one time and you'll be able to eat it faster. So if somebody has a gastric sleeve and at first they're very successful because they have to eat relatively slowly and the amount of food they have to eat before they fill up is much less than it was before surgery, then they lose weight and they're maintaining their weight. And then after a couple of years, they find out, oh my gosh, I can eat a lot faster and I don't get satisfied as much. And my weight's going up. Now, the correct thing to do is not to tell the person, well, it's your fault. You're eating too much. I don't know how much I'm eating and I don't measure how much I eat. If I start to feel like I'm satisfied, I stop eating. That's normal. So if we do a surgery that causes somebody to feel satisfied with smaller amounts of food and eat more slowly, they will do so. Now, if the surgery changes over time and they can eat a lot more before they feel satisfied, well, the problem is they'll tend to eat more and it'll be subconscious. They don't plan this. So it's very important that the stomach stays the correct size. The thin portion of the stomach that we take out expands easily. When you do the surgery correctly, the portion that's left in is very thick and doesn't expand very much over time at all. Okay. Now, if initially the stomach is bigger than it should be, it'll seem different to the patient for sure, because initially the stomach can hold 1 liter and now it can hold maybe 20% of that. Okay. But when you do the surgery correctly, instead of being able to eat, 2 double cheeseburgers, all of a sudden you can have 3 bites and you feel full. Okay. That doesn't last forever, but it lasts for a while and you lose a lot of weight. The stomach expands slightly and you're able to eat more. And then your weight balances off and then you get on with life because you're now at a healthy weight. Okay. If the surgery is done incorrectly, so you can eat too much at the beginning and you think I'm eating less, but it's not really as small as the amount that we usually see with somebody who's had the surgery correctly, then there's more of the thin part of the stomach remaining in, and that part of the stomach has a much higher propensity to dilate or expand. So what I see in that situation is that somebody says, "Oh, I got a bunch of weight off, but at 6 months I could eat a lot more." That is not supposed to happen. 6 months after surgery, maybe you can eat a little more after a gastric sleeve, but you shouldn't be able to eat a lot more. Okay, if the sleeve is done correctly. Maybe one person out of a couple hundred can do that, but it's very uncommon. If the procedure was done correctly for the first year after surgery, for sure, you're eating quite a bit less and you're less hungry. Over time, however, it's not uncommon for the stomach to expand enough that people start to regain weight. Now, if somebody has modified their diet so that they're eating a healthier diet, if you can eat a little bit more, you're not going to gain weight because I mean, I'm eating an extra salad a day. I'm eating an extra piece of chicken or steak a day. That doesn't cause people to gain weight. Eating more French fries or, something like that, that'll definitely cause you to gain weight. So generally, if somebody's eating a really healthy diet and it expands a little bit, uh, they're not going to gain really any significant amount of weight. Okay, what I'm seeing these days is online, a lot of people being told, well, you typically gain weight after sleep, take GLP-1 medications. And there's a lot of people that have had a sleeve that are taking GLP-1 medications. What that tells me is one of two things is going on. Either the stomach is expanded and the anatomy isn't correct, or you're just never ate a healthy diet. You just ate less of a crummy diet, lost weight based on that, and now you're regaining it. Interestingly, what's also being reported is that after a gastric sleeve surgery, the people who are on GLP-1 medications have a much higher chance of malnutrition. Well, I think that's because they started eating more of unhealthy food. Then when they took the GLP-1, they just ate less, but they still were eating an unhealthy diet. And although they got, 15 pounds, 20 pounds, whatever it is off, because of their unhealthy diet, they are now malnourished. That's what I think is going on. And I've seen that. Somebody comes in and says, I'm taking this GLP-1 medication. It's keeping my weight off. I gained about 20 pounds and now I'm back to where I should be. And I check their lab tests and they're low on a bunch of vitamins and they're low on calcium, they're low on iron. And I say, something, you've got a problem. Well, I'll just take another pill. So the solution is, now take a vitamin. The bottom line is, you eat on an unhealthy diet, doesn't matter the vitamins you take. I mean, they'll help out some, but that unhealthy diet is going to impact, your muscles, your metabolism, a whole bunch of other things that have nothing to do with the labs we measure. And so the solution there is to get back on track with a healthy diet. You can use the GLP-1 to get the weight off, but then transition to a healthy diet and drop the drugs. You don't need them. That's actually, I talk about that right here in this book, Dietary Rebuild, how to rebuild and get back into a diet that will keep the weight off and is healthy. However, if the stomach has expanded, you can easily have a re-sleeve or you can convert to a bypass. Those are really the two best options from an anatomic standpoint. And then you don't have to take drugs for the rest of your life. Then you actually get the feeling back that you had shortly after surgery where you're not as hungry, you feel full with smaller amounts of food. People say, well, if I convert to a bypass, I'm going to get a lot of malnutrition. That is not true. I've done thousands of bypasses, and the vast majority of patients aren't malnourished. They take a vitamin and they eat their diet and they're fine. And the surgery has a much lower chance of weight regain down the road than a gastric sleeve. And that's just a fact. It's about twice as big a chance of regaining weight after sleeve as after a bypass. And they overhyped the thing about, nutrition problems with bypass. I've done over 5,000 bypasses, and I've seen very few people with significant malnutrition due to the bypass. It happens, but it's very rare. I've also got a bunch of publications. I could hold them up for you where they say gastric sleeve results in a high incidence of malnutrition. Well, that's because people are eating an unhealthy diet. They have the gastric sleeve. They continue eating an unhealthy diet. They just eat less of it and they get malnourished. What do you know? So the real solution when the stomach expands after a sleeve, which is fairly common after several years, is to have a re-sleeve or convert to a bypass is actually even a better solution than that. Adjust your diet so the fact that you can eat more doesn't matter. And I think, unfortunately, what most people are doing is getting on these GLP-1s, but I think that's sort of a last resort. There are problems with those drugs, and I discussed those in one of my podcasts, and I'll be discussing it periodically. I do prescribe them. I think they work, but I don't think they're the smartest thing to do or the first solution when the stomach expands or you can eat more after gastric sleeve, both of which tend to be common after 3 or 4 years. Anyway, I wanted to talk about that. The number one reason for a gastric sleeve being too big is the surgeon made it too big in the first place. The number two reason is, unfortunately, that after a gastric sleeve, the stomach tends to expand 3 or 4 years down the road. These are the realities of a gastric sleeve. I don't do the gastric sleeve operation anymore. I do my SLIMS procedures, but I do have a lot of patients that have had the sleeve, and I do find myself discussing weight regain with them periodically. Okay, I hope you got something out of this video, and